Being diagnosed with a serious illness is everyone's worst nightmare, but with new innovations in technology, what once may have been fatal may now be treatable. Joining us now is the CEO of Lantern Pharma, Sharma, to share how they use artificial intelligence to help treat cancer patients. Panna, good morning.
Oh, thank you. Glad to be here.
Wonderful conversation to have with you. Tell us, what does Lantern Pharma do?
We focus on developing new cancer therapies by using big data and machine learning, really by using all the great tools that artificial intelligence has put on our doorstep the last few years. So really, like every industry has been totally changed by AI and data. That's what we're trying to do for cancer drug development, is transform the industry, make it cheaper, faster, more accurate to develop cancer drugs.
When we speak about cancer, there's a lot of aggressive cancers. There's different types of cancers, and the ways we treat them are also different. How does AI accelerate new innovations that help in the pharmaceutical industry?
It's a great question. So one of the most important things is to understand how drugs work or don't work. And by being able to understand that, we can compress the timeline of drug development. The second thing that's very important is oftentimes, as you mentioned, in many cancers, you bring drugs together in combination therapies. In fact, many of the cancers that have been almost cured have been driven by combination approaches. So understanding which drugs can be brought together, again, is a big data problem. And then third, and very importantly, is can a drug be used in new indications? And we've done that now with 2 drugs where they didn't get to the right endpoints in traditional trials, but by understanding what cancers they really work in effectively by looking at genomic analysis, we're able to then relaunch the drug in a new setting. And this is really all a data-driven approach. And that's, data essentially helps us guide the development and lower the cost of drug development.
What approach and treatments are you using for pediatric cancer?
Yeah, that's one that's very important, near dear to my heart. There are over 16,000 new cases every year just in the US, about almost 250,000 plus globally. And in the last 15 years, only 4 new cancer drugs have been approved for pediatric cases, whereas in traditional cancer development, there have been over 80. So we uncovered one of our drugs that worked really well in a set of brain cancers. And many of those brain cancers were ones that attack children. And pediatric cancers are particularly unique because they tend to be fast moving, they tend to be aggressive. It's hard to treat children without having the right set of adverse events or toxicity profiles. So it's an area where I think we need personalized and more precision therapies. And so we launched our very first program in a very ultra rare brain cancer called ATRT, atypical teratoid rhabdoid tumors. It affects only about 70 children a year in the US, but the outcome is very poor, and there's no approved therapies. But in doing so, by using AI, we understood that there are many other many other cancers, pediatric cancers, where this drug can work. And so pediatric cancers, I think, are really important, not because there are few therapies, but also because by studying pediatric cancers, we actually unlock many new insights about cancers in general.
Where can we go to learn more about Lantern Pharma and the AI and everything you're using to help combat cancer?
I think always the best place is our website, lanternpharma.com, but we also have very good Twitter and LinkedIn. But our website has a lot of information about our portfolio and also our AI-driven approach.
Wonderful. CEO of Lantern Pharma, Sharma, thank you so much.
Thank you. Thank you very much.